Do you know what's this connection between inflammation, sleep, and obviously pain?
We're far from the final word. A lot of research is still being done. More than 80% are getting bad sleep, which is no good.
Why is sleep so important in patients' life?
I've really come to appreciate how magical sleep is. People with autoimmune conditions have lost the ability to regulate their immune system. Dig a little deeper and find out only sleeping 4 to 5 hours a night.
Welcome everyone to another podcast, Thriving with Arthritis. Today, I'm very happy to have a new guest, Dr. Elizabeth Ortiz. She is an experienced rheumatologist. She worked as a digital health CMO. She is an entrepreneur. She is a graduate of Cornell University, and she completed her rheumatology training at LA County Hospital, where she then served as a faculty for 10 years. She has an extensive experience in complex patient care, specialty care program design, and education at multiple levels. As a rheumatologist, she has a very big interest into chronic autoimmune and inflammatory conditions, and she understands the complex caring for this type of population. And because she has a talent from making the complex understandable, Dr. Elizabeth started an educational channel called Connected Rheumatology, where she is educating people with autoimmune diseases. And she acquired over years more than 60,000 subscribers, and she has more than 4 million views. Dr. Ortiz, thank you for accepting my invitation.
Oh, well, thank you for having me. I'm excited to do this. Two rheumatologists talking. It's going to get real nerdy.
Yes, it is. Today, I choose a topic that I know you are passionate about. It's about sleep, because sleep is so important to our life. We don't even realize how important it is until you think about how much you need to sleep in a day. And if the average night sleep is about 8 hours, that means that we sleep about 1/3 of our life. And I read somewhere that if we live about 75 years, we actually sleep for 25 years. Isn't that something?
Yeah.
And we tell our patients all the time how important the sleep is, how important the quality of the sleep is. But can you explain to us why is sleep so important in patients' life?
Yeah, no, I didn't necessarily wasn't trained in sleep, and I'm certainly not a sleep medicine expert, but if you practice rheumatology long enough, you start to realize how important it is for our patients and how much it impacts their pain, their fatigue, all the complaints that they come to us with, and then you dig a little deeper and find out only sleeping 4 to 5 hours a night. So it's really, really important. And so I've really come to appreciate how magical sleep is, and how vital it is as a kind of holistic approach to any autoimmune condition. The nitty gritty of sleep is kind of beyond what I think most rheumatologists do, and that's where we rely on our sleep medicine consultants, because there's different types of sleep problems, right? There's just insomnia, there's parasomnia, there's central disorders of hypersomnolence, there's breathing disorders, circadian rhythms, sleep-wake disorders, movement disorders. Like there's a lot of different sleep disorders, and figuring out the best way to approach each one. Like I said, I rely on my sleep medicine specialist, but even just bringing up the concept of sleep and talking about it. A lot of times patients, especially our patients, they see lots of different doctors, right? And very few of those doctors are even asking about sleep. And so, yeah, no, I have definitely come to realize and then incorporate it into my practice and like get people thinking about what their sleep habits are.
There are more and more research papers coming out about sleep and how sleep impacts our health. And as you said, people are talking today about sleep more than I remember talking about 10 years ago. But when it comes to inflammation, because you mentioned autoimmune diseases, do you know what's this connection between inflammation, sleep, and obviously pain?
Yeah, no, I think the final, we're far from the final word. You know, a lot of research is still being done. And anytime a new concept like this is being approached, the first thing we always do, right, is just figure out, is there an association? And so with rheumatoid arthritis and really all of our autoimmune conditions, we definitely know that like less than 20% of RA patients will report getting good quality sleep, which means more than 80% are getting bad sleep, which is no good. And then what is that relationship to their disease? And that's what we're still trying to figure out. It becomes a little bit of a chicken and an egg situation. It's like, well, did poor sleep cause rheumatoid arthritis, or is the rheumatoid arthritis causing pain? And I know a lot of patients have told me, well, of course I have a bad night's sleep, I'm in pain, right? And so it's complicated. Are you sleeping poorly because you're uncomfortable, because your joints hurt, or are there other things at play? What I like to do and what I have found really interesting is when you take a broad view of autoimmunity, and I like, you know, it's your immune system is hyperactive and ineffective. And what we know is happening is that you have lost, or people with autoimmune conditions have lost the ability to regulate their immune system. And so there, we know that there are certain cells and proteins as part of our entire immune system who serve to kind of be that checks and balances for our immune system. And one of the cells that does that are our T regulatory cells. And I'm getting a little kind of nerdy and biologic, but I have a point. So these T regulatory cells, we know, kind of scan the immune system and find whenever things are going haywire and kind of cut it off at its source so it doesn't become a problem like an autoimmune condition. What I have found really interesting is that there's science that shows that these T regulatory cells work on a circadian rhythm. And so that they are at their maximum kind of effect, like they have their maximum potency at night. And so there's a theory that if you are getting persistently bad sleep, so not just like one night, but like night after night after night, that is priming your immune system to be dysregulated and kind of can tip you over into that autoimmunity, which I thought was fascinating. Also, because in my previous life, when I worked in academics, one of our older faculty members had built his career on T regulatory cells. So I heard about these cells a lot. And so I was like to see that the work I've been hearing about forever and kind of see that translated to what I see in the clinic every day of people having difficulty sleeping. I liked it, and I kind of nerded out so much so that I then like texted the paper to my rheumatology friends. So yeah, no, I think that there's a lot of interesting science explaining what we see in clinic all the time, which is if you sleep bad, you're going to have a bad next day. And now we are better understanding the mechanisms, like the biological mechanisms underlining that, of how that bad sleep is priming your immune system to just be dysregulated, go towards more of that pro-inflammatory state. And it's really hard um, to get control of that if you're not also addressing the sleep.
I have to tell you that I love the nerdy part because I have a PhD in immunology, and the reason that I got into rheumatology was because I thought I'm handling the immune system knowledge pretty well. But as you said, research has evolved a lot over the last, I would say, 15 years. When I started my PhD, we only knew about Th1 and Th2 type of cells. And then we were actually talking about a special type of cell, which later on we found out that it was T regulatory cells. And I like the fact that you mentioned that because we don't even understand how our immune system controls our body. And this is a way that puts into the light spot, the fact that your immune system doesn't sleep while you are asleep, and it's actually recharging. So it's gonna regain that power to fight infections or to fight any kind of trigger of the immune system. So that's extremely important for my audience to hear about the nerdy part. Now we talk about stress. We talk about stress all the time, and we tell people that they shouldn't stress about the disease, and that stress is bad for their health. We often tell people about an autoimmune disease, but the moment that we make that diagnosis of an autoimmune disease, I believe stress is going to become part of their life. So, in that situation, stress will affect the sleep. How do you support your patients? How do you advise your patients to decrease their level of stress when you deliver the news of an
Yeah.
autoimmune disease, and to help with their sleep, obviously?
Yeah, that's tough because you're exactly right. You know, we as rheumatologists usually see patients at a, you know, when they're not doing well, when they have kind of been through the ringer. A lot of them have seen lots of different doctors, gotten lots of different diagnoses, have just gone in lots of different directions. And in some ways, it's a relief to get a diagnosis. And in other ways, it's just a giant bomb of being like, you know, this is a life-changing diagnosis that, for all practical purposes, you know, is not curable. And so, yeah, no, it's kind of inherently a stressful situation. And I don't find that necessarily fighting that is the best way to approach it. What I would recommend and what I do with my patients is, in the beginning, especially when you've just kind of landed them this big bomb and this big new diagnosis, is seeing them more frequently in the beginning, for a number of reasons. One, you can answer all their questions, because people do not have all the questions in that first visit. They need time to go home and process and research and talk to friends and family, and then come back and have more questions. And also just to reiterate some of the things that you say, you know, even if you've, as a patient, if you've been in the room and kind of gotten big news, you know, your brain kind of shuts off and you only hear about 20% of what the doctor's saying. And so having someone come back in 2 weeks or in 4 weeks and like just reiterating, answering questions and helping them get comfortable with the new reality, I think is one of the strategies I like to do. Although it's difficult, it's definitely difficult in a traditional kind of clinical setting where you don't have that much time. I think it really helps set very solid foundation for understanding the condition, understanding the strategies that we're going to take to deal with it. And then, yeah, talking about stress management and sleep. It is a challenge when you have so much information about rheumatoid arthritis, about their test results, about the medications you're going to use. It's a lot. I almost feel like it's a lot as the person who's giving that information. Like I'll be talking like a mile a minute because I have so much information I need to give. And so when you start then say, and now let's talk about your lifestyle, it's a lot. And so what I like to do is just ask questions and plant seeds so that they can then on their own be thinking, oh, you know, she asked about my sleep and it hasn't been great for a couple years, and it's just planting the seed for a future conversation. But yeah, the diagnosis of any autoimmune condition isn't really just that one visit, right? It's like a series of visits in the first, I'd say, 3 months. And then, you know, and you're trying different medicines and trying to get control of the disease, and that can be 6 months. I think it takes a new diagnosis, someone with a new diagnosis, it can take a year to really feel like you know what you're dealing with, you know what the strategy is, you've found some meds and some lifestyle things that are working for you, but you're still tweaking things, but you don't feel quite like you're hanging off the cliff. I don't know if that answered your question, because it's not really like I don't have like a do this type of strategy. It's really like it's a long game.
I have to say that I resonate with these ideas 100%. I do the same. I try to break down the news, but I also try to feed the information gradually. And that's the practice that I have envisioned and I build, a practice where I can bring the patient as many times as needed, more frequently in the first 6 months. And then as they feel comfortable with their disease, their level of pain, their understanding, they respond to medication, then we switch to see me rarer. I mean,
Yeah.
to see me more like every 3 months than just every 2 weeks in the beginning or every month in the beginning. Um, it is very true. When you deliver the news, they don't have the capacity to absorb much more information. They might ask you questions about
Hmm.
treatment or about prognosis, but they will not be able to understand that this is a journey, is not one time visit.
Yeah.
And if we build up as physicians on this relationship and they understand that we are there to partner with them, then the outcomes are much, much better, in my opinion, than
Oh,
just
for sure.
seeing them once every 3 months, especially when you deliver such a diagnosis, which can be
Yeah.
very stressful for them. I know
Yeah.
that you said that you don't have a specific toolbox, but do you have any strategies that could help your patients, um, kind of think about their sleep, addressing the sleep problems? And do you prefer to go on the natural side or just prescribe pills?
My bias is never never pills. I'm not a big fan of pills, although I definitely prescribe them when necessary. Um, this is where it can be a little frustrating for patients because there's no one size fits all. And it's more in the beginning understanding what someone's particular problem is. And so it's a lot of questions. It's like, well, what exactly is the problem? Are you having breathing problems? Sleep apnea, we know, is a huge problem in all of our conditions. That's, in the realm of sleep issues, reasonably easy to fix with a CPAP machine. And so asking those kinds of questions, restless leg syndrome, asking, is this a problem of not being able to get to sleep? Like, you go to bed at 10, but you're not actually falling asleep till 1. Or is this a problem of waking up multiple times in the middle of the night? And so you kind of figure that out. And then, like I said, if you're worried about sleep apnea or restless leg, I'll send them for a sleep study. I'll, send them to see a sleep specialist and get that under control. And sometimes that's all they need. And then it's almost like that was an extra layer. You've taken that layer off, and now I can just focus on the autoimmune condition. If someone's having difficulty falling asleep, I have found that a low dose melatonin strategy can be very effective, because what you're trying to do is, I kind of visualize it as pulling them back into a more healthy circadian rhythm. And we're animals, and it's pretty basic. Like, we should go to bed when the sun goes down and get up when the sun comes up. And so there's a low dose melatonin, because I think that's the other thing is people tend to take too much melatonin.
How much is a
Anything
low dose?
like point 0.5 or 1 milligram.
Hmm.
And you can take it a few hours before you're naturally going to bed, and then creep that up. So let's say someone goes to bed at 1, you can take your low dose at 10 or 11, and then every week or so creep that up to try to get your, I won't say bedtime, but when you go to sleep, try to creep that up closer to like 10 p.m. And then if someone is waking up multiple times during the night, again, figuring out why. Do you have to pee? Are you having pain? Are you having racing thoughts? And then focusing your attention on those reasons. The challenging ones is when you have like a mix of all of it, which is common. And so trying to figure out where you're going to get the most bang for your buck. And also kind of making sure that your sleep environment is the way it should be, like it's cold, it's dark, that you're staying away from the blue light in our devices, which I'm horrible at. Like, I am like, do as I say, not as I do, because I'm not good at that. But like making sure that they're like the basics are taken care of, is also important too.
Where did you learn about all of this? In medical school, in your
Oh,
residency?
Definitely not medical school. Medical school was a very long time ago, and I don't really remember learning about any kind of integrating lifestyle into anything. And what we were learning about was like heart disease and cancer, and then medications and how to interpret test results, but certainly not lifestyle stuff. Residency and fellowship, again, I wasn't given guidance, but that's such an intense time in a young doctor's life. You're seeing so many patients, and it was during those years that I could definitely recognize the need for addressing it. But again, I didn't have any guidance on how to do it, so I had to do a lot of self education. And when I became junior faculty right after training, I then took part of I became board certified with integrative and holistic medicine to expand my toolkit, because it was very clear, especially when you're dealing with autoimmune patients, that my toolkit of pharmaceuticals was lacking and that I needed more. And so, yeah, I had to do it on my own.
Now I'm going to share my experience. The same like you. I was growing up wanting to be the scientist who understands the cellular level, the molecular level, and I went towards that. I pursue a PhD. I finished that, and then I returned to clinical part of medicine. And when I returned to the clinical part, I realized it's not all about the cells. It's about the human being that it's in front of me. And I started to learn about lifestyle from my patients. I was seeing that with all the advanced tools that we had, diagnostic and also treatment, some patients were doing so much better than others, and I couldn't understand why. So I started to interview my patients, the researcher mind. What do you do outside of this? What do you eat? And one of my patients educated me about mindfulness. He
Mhm.
actually told me about mindfulness. I had no idea about mindfulness. I thought it's all about meditation, something like a Buddhist monk, but in my mind, my researcher mind, was no connection with mindfulness. So when this patient of mine told me that he started to practice mindfulness, and not only that he feels better in terms of no more pain, no more struggling in the mornings. He improved his life. He was going through almost through a divorce. He was dealing with a child that had a lot of medical issues. But when I heard about that, I went to my computer and I started to research mindfulness and rheumatoid arthritis, or mindfulness and chronic pain. And I started to see a lot of articles that were written, I think, about 10 years ago. Now things evolve, and the
Mhm.
majority of the big name university, world renowned universities, they promote mindfulness as a tool for patients with chronic pain. But when I started to research it, I was blown away by the amount of information that was there, and nobody in medical school, residency, or my fellowship pointed towards lifestyle. So I think we have to learn
Yeah.
from our patients. But will that make us better doctors if we incorporate
I
lifestyle?
think, I mean, obviously, yes, right? Like, talking about patients' lifestyle is talking to patients, right? Like, it's
Correct.
getting to know the patients, getting to know how they live their life, and then taking that information and incorporating it with what you know to be going on physiologically. And it'll be interesting to see how things settle out. But our current system, where as doctors we're kind of behind a computer, we're obsessed with looking at labs and then getting out of the room, it doesn't really lend itself to being able to sit down and talk with the patient about their life, which is really what talking about their lifestyle really is. Yeah, I know you really can get, when you sit down like you were just talking about with your patients and figuring out what they're doing, either for the good or for the worse, you really
Correct.
are learning a lot about them. um, yeah, no, I have a lot of thoughts. I have a lot of thoughts about 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 all of this. And as good as it is that we are now, I mean, it's kind of come pretty quickly, right? Like the fact that you and I are here sitting we are board certified, traditionally trained physicians talking about the real science behind why these lifestyle things work. Like, that's amazing because, we've been around the block, but we're not that old, Diana. Like, it's come pretty quickly. But the flip side of that is that our traditional systems are a little slow to act. And so it hasn't quite made its way into traditional practices. So what has happened is you've now opened up a marketplace where non-experts are now coming to the forefront and speaking to these ideas, but who don't necessarily have the expertise, especially with autoimmune conditions, that we do. And so I have found that to also be a challenge. And so that actually leads me, because I've done a lot of talking, and now I want to ask you some questions, and kind of along that lines of, like, there's a lot of information out there, and there's a lot of information specifically about diet when it comes to autoimmunity, rheumatoid arthritis. And so I know that you hold diet like a special place in your heart. And so what are some of the things that you have found in your practice when patients first come to you? What are some of their thoughts that they already have about diet, and how do you approach that and help them perhaps think of it in a more productive way?
I feel great that you are interviewing me now because you know about my passion related to rheumatoid arthritis and talking about diet. I have to agree with you. There are so many people that talk about autoimmune diseases that never diagnosed or properly treated a patient with autoimmune disease. But coming back to this idea of diet, just the word diet, it's creating a lot of limitations in patients' mind. A lot of patients, when they hear about the diagnosis of rheumatoid arthritis, they come to me to ask me, what is the best food that I could eat? What is the best diet for me? What is that anti-inflammatory or autoimmune protocol? They hear about these big names and they believe there is a secret formula behind it. And what I tell them is, like, you have to approach it from a big angle and kind of narrow it down to a smaller angle when you're going to take things that are applicable to you. Even in my patients, what I do, I ask them to write down what they eat for about 2 weeks, and then I go through that and I identify things that they can remove. And that's a first step. What is happening out there, a lot of people talk about diets and protocols, but they don't give any actionable steps to patients. And that's a problem because you have the knowledge, but you don't know how to apply it. And that's not going to help you in the long term run. So those are the first things that I do with my patients. I have many, many tricks that I can share. And I actually use my YouTube channel. I give a lot of information for free because I have seen patients coming to my practice with all these ideas that there is a specific formula, there is a specific pathway that you can do things. And I try to educate them. But when they come to my practice, I actually have the time, like you said, in multiple visits to educate them about what is important to know about food that you have to incorporate. And I think most important is food that you have to eliminate.
Yeah. Yeah. Yeah, no, I think that's super important, to the idea that there's no one size fits all, that there's no kind of one program, that it's very individual, and also individual to their lifestyle, right? And their culture. Telling, at least in my family, telling us that we can never eat tortillas again is like, it's not going to happen. So I think being able to personalize it to the person is really important. What I have found when talking about diet changes is that it can be a challenge to make lasting changes, not only when I've been talking with patients, but even with myself. Like, it's sometimes hard to make long-term changes that really last. Do you have any tips or tricks regarding how to make it stick?
I will tell you what I do with my patients. I don't know if it's the perfect solution or not. I actually share with you that I'm in the process to write a rheumatoid arthritis book that will relate that to lifestyle for patients. And before I tell them how to do it, I give them the why. Why is important. I give them the science. There is a lot of science that proves that doing certain interventions like eliminating certain foods, adding certain foods will help you. So they have to understand why. And then, what I do in my practice, I have created like a coaching program that could be one-on-one or could be like a group coaching. Every 2 weeks, I would meet with my patients and I would feed them the information that they want to know. And then I even ask them to find an accountable partner, like someone in my practice or someone in their community, because they don't have to be patients of mine, but they have to find that accountable partner that will remind them, or they will go over certain steps that they will make to be consistent. The other thing is, like, when they are in a community of people that they do the same things and they share the success but also the failure or the struggle, they don't feel alone and they know they have the tools. Because that's the other thing, you learn that you have certain tools that you can apply. So even if you fail for 1 week or 2 weeks because you are in vacation, then you have the tools, and then when you come back from your vacation, you can retry to be on that right path. And the other thing that I talk to patients, and I think it's extremely important, is change that mindset, that you cannot do it, or change that mindset that it's something that you have to do in 2 weeks or 3 weeks or a month. I tell them this is your lifetime journey, and this is going to be from now on. You have to learn, like you learn to talk, like you learn to walk, like you learn to right, you learn how to treat yourself from
Mhm.
eating the proper thing, exercising. And I also tell them there is no formula for everyone, so whatever exercise is going to work for me or I enjoy is not going to work for you. I love to dance, for example, but not everybody likes to dance. Some other people, they like to go to the pool. So I try to give them those options, and I try to put in their mind that you can do things that will be applicable to you, but they are still beneficial. It doesn't matter that you don't dance. It matters that you are doing an exercise that will keep your joints flexible and will keep your joints moving. The other thing is, like, I talk to my patients about what is mindfulness, because I was clueless before. I went to take a course at University of Massachusetts where Dr. Kabat-Zinn started the program. I wanted to go to the roots of this movement, and I learned myself what it is mindfulness and how to apply this in my life before I share it with patients. I'm not a mindfulness teacher, but I introduce them to the idea. Again, I give them the science, and then I tell them a few easy methods that they can do, like a breathing technique. And then they start doing it, and then it opens their mind to do other techniques. So this is the way that I approach it to help them to stick to their lifestyle
Yeah.
changes.
Yeah, no, that's amazing. It really resonates what you said is like learning how to treat yourself. It's very similar to how I've worded it, in that what an opportunity having an autoimmune condition gives us to learn how to take care of ourselves. And if you take a kind of real big step back, I think most people at some point in their life gets faced with something kind of world shattering, world changing, that if you look at it from a certain point of view, can be seen as an invitation to learn how to take care of yourself. And I think autoimmune conditions are one of those things. And it's frustrating. And I think a lot of people get hung up on, like, your life is no longer going to look the way you thought it was going to look. And also the way you thought it should look. We're fed so many different narratives in the culture about what being an adult, what being successful, and all those things. And it all kind of culminates when you find out you have this condition that all of a sudden that life is just like disappears. And it doesn't have to. It's just it's going to look different. And you have to learn how to take care of yourself so that you can then kind of develop what your life should look like for you. Yeah. So, anyways, I really liked that. So we've brought up your clinic a couple times, and your clinic is definitely very unique and innovative. And you don't accept insurance, and you offer what many people would consider, and I think we've talked about this concierge level of service and attention to your patients. How do you find that type of clinic and attention really serves rheumatology patients in particular, and how's it going?
First of all, I would like to thank you for bringing up my clinic. I very, very rarely go out to talk about what I do exactly, because I thought that my patients know what I'm doing, so I don't have to, be there and sell this idea. I started my clinic, Rheumatologist OnCall, in 2019 when I was still in an employee position. I have seen this need of patients that were having autoimmune conditions to see a rheumatologist, and they were traveling for 3 hours to see me for 5 to 10 minutes. That was the initial thought. And I started to think about how can we serve the patients to the next level to avoid all that hassle, to avoid all the drama of traveling, sitting in a waiting room, and then seeing me for 5 minutes to renew your medication. And, you know, I was doing my entertainment, my banking, my shopping online a lot of times because I was very busy. I have 3 kids, family, everything along the list, and then I was having a very very busy clinic. So I was thinking that maybe telemedicine could be an option. And when I started to tell people around me, my friends, my colleagues, everyone looked at me like I was coming from another planet. And they were saying 2 things. First, we are not in Star Trek, so to see a doctor on camera. And then second, they were telling me there's no way to bill. And at that point, I realized that, it was more important how we bill than what we do for our patients. And that was a wake up call for me. The second thing that I've noticed is like when a patient was losing his insurance, he was not able to see me, or he was not able, or changing the insurance. He was changing the insurance. My hospital was not longer accepting that insurance. My patients wanted to continue to see me, but they couldn't afford it financially because they didn't know how much they will expect after that visit. And some of them, they did come to see me, and then they were hit with huge bills just because my hospital was not taking that kind of insurance. And I said to myself, what is this? I cannot help my patients when I want and how I want. And the other thing is like, I don't know how much they're gonna pay to see me because I was completely blinded. I didn't know how much my consultation will cost. I didn't know the test that I ordered. I had no idea how much they will cost the patient. And I had patients that were coming to me with a bill of, I'm not exaggerating, $4,000 after the first visit. And I was frustrated to see all these things because I knew all this money are not coming into my account. And I felt like I'm financially responsible to burden this patient because they will be in such a difficult situation to come up with the money to pay for that bill for one visit. So I designed in my head a clinic where patients could come to see me, and everything will be transparent, and I will be there for my patients when they need me the most. And I started to collect information, and it was extremely hard at that time because people were not talking about telemedicine. Lawyers that I was trying to build up the company, they were looking at me as like, I've never heard about something like this. You don't want to contract with insurance companies. You don't want to, you want to be on a camera to see who's going to believe in that idea. So that was the initial stage, and I was discouraged, to be sincere with you. But I continued to build up, and on April 7, 2020, it was in the middle of pandemic, I finally got the papers for my company. I put the company together after I talked to probably 6 lawyers. I don't know how many accountants. I don't know how many colleagues. And I took a course in telemedicine, which was helpful, but not so much because I wanted to apply in multiple states. It wasn't, just in my state. So, yes, I built up this concierge type of practice where I don't take insurance for my services, but the patient can use their insurance to pay for everything that they want, from medication, laboratory testing, imaging testing. They cannot pay for my services, but I can provide them with a super bill if that's helpful for them, and they can submit that super bill to their insurance, but it's not in my hands. The other thing is, like, I'm not controlled by insurance companies, so I can very easily disclose the prices of labs, medication, imaging, the cost of my consultation. And that helps a lot of patients to plan everything, because today everybody has a high deductible, including
Mhm.
myself. So
Yeah, no, including me too.
until you meet that high deductible, you are responsible for a lot of costs. So
Mhm.
it's important to you to pay, if you're going to pay $200 for a set of labs versus $2,000 for the same type of labs if you apply through your insurance. So my patients have the ability to choose. They are empowered to choose what is best for them, and they find that fascinating. They cannot believe it when I disclose them the price of their labs. And I'll give you an example. Like, for a whole set of autoimmune disease labs, it can be up to $500.
Yeah.
But if you go through your insurance, I can guarantee you it's at least $5,000. An MRI, in through my practice, could be, let's say, between, depending on the location, between 250 to 550 or 500. But I can guarantee that if you go to your hospital or if you go through your insurance, it's going to be $5,000. So, and the same for medication. When I tell patients that they can buy their methotrexate for $9 per 3 months supply, something like this, they cannot believe it, because they say, oh, but I pay $20 every single month to my local pharmacy. So again, finding this kind of options for patients. And I was able to do that because I step outside of the traditional model, the
Yeah.
traditional insurance system, which was basically putting a veil on my face and going in that direction only. But now this clinic gives me the opportunity to go in multiple directions with the ability to help patients to the best that I can. Okay, I cannot fix everybody's problem, but I can tell you how much my service will cost, how much your labs will cost if you want to use it. So
Yeah.
I put you in the driver's seat, and you can decide where your money will go.
That's amazing. Yeah, no, and I think just the fact that you stuck through it when people were kind of giving you reasons to doubt, you show them.
And the other thing is this flexibility that I have. I can see you if you need to be seen. I can see you today. I can see you in 2 weeks. I can see you in a month. I can see you every month until you feel better. And I can tell you, Elizabeth, so many stories from patients. I should take some time to write their stories. These are so powerful stories of patients that they couldn't find relief or they couldn't find a doctor. Many rheumatologists in this country, because we are so few, they are booked out for about 6 months to a year.
Mhm.
And that is because they are trying to maintain their practices and work with insurance companies to, see more and more and more patients. Their reimbursements will decrease in time. That's a no-brainer. We all know that. So it's happening for the last 20 years. It's going to continue. There is this huge disconnect between patients and physicians. And the reasons are mostly you don't have the time. You just have to see so many patients to
Yeah.
maintain a clinic working. And many times you are forced, if you work in a big institution, you are forced to see people that should not come to you. Why? Because other doctors don't have the time to sort it out, or their primary care physician doesn't have, or the primary care
Yeah.
physician is, pushed, incentivized to send the patient to the specialist because it's more money coming from there, right?
Hmm.
So the more patients you see, the more money you generate to the system, but that will not help you as a physician in that relationship with your patients.
Yeah,
And
and it doesn't help the physician and it doesn't help the patient. I mean, I think the kind of going back to what we were talking about with diet and sleep and lifestyle things, and why there's kind of so much frustration, especially from patients, is, well, why didn't my doctor talk to me about this? And part of it is they might not be as educated because, like we talked about, we didn't really have any formal education in this. But also, there's no time. There's no time. And it's like impossible, as much as we kind of want to look at medicine in this kind of purity, like it's just the doctor and the patient, like working together to get each other, to get the patient better. Um, you have to talk about the economics. You have to talk about the economics of a clinic and what clinics and physicians have to do to keep a roof over their head, and the number of patients they have to see. And there's only so many hours in the day. And so that means that doctors only get a certain small number of minutes with each patient that doesn't allow for these kinds of conversations. And so, yeah, I think everyone, you should talk about your clinic more. Everyone should know about it.
thank you so much. I think we should meet and talk about these kind of problems that we see, especially because we have seen them, we have lived them, we have tried to do things differently. And then because we couldn't, we had to step outside and do things that we thought are appropriate for patients, but also for us. Because as you said, we should put price on what we do, and we should put price on our health. Because I can tell you that when I was working in the traditional system, I was having 25 to 28 patients every day. And then because I was not able to write notes for my patients while I was talking to them, I was putting orders and putting the instructions, but I could not write, my notes while I was talking to the patient. I'm not so good at typing. So I was getting home, feeding my kids, taking my kids to activities. And then at 10 at night, I was sitting down to the computer every night until 1 or 2 in the morning to write notes. Why? Because most of the time, I was told that if I don't put it in 48 hours, I will be penalized as a physician. They will take some money from my account
Yeah.
because I'm not submitting the bills in time. So those kind of things, I don't have them today. So I can concentrate on my patients, but I can also concentrate on my kids as well. So
Hmm.
it's that balance that we all look for. And I think
Yeah.
it's important to come up to that balance to be able to help others. It took me 40 years to realize that that I have to help
Yeah.
myself to be able to help
Yeah.
others. And every
Yeah.
time I was traveling with an airplane, and they were saying, put the oxygen mask first,
Hmm.
and then you put it to the person next to you. I was like, that what's that? That this is
Yeah.
not applicable
Yeah.
to me.
Yeah. No, I hear that. I mean, yeah, my, as you know, my kind of employment journey is not dissimilar to yours, and kind of the frustrations that I had. And I've taken a few different twists and turns with my own practice, and then in digital health. And what I'm doing now is really trying to, there's so many problems, like we've talked about, right? Like there's so many problems in this system. And as much as people need to, come and see you, you can't see everyone. And some people, because of their insurance, because of their circumstances, they just need to see the local rheumatologist. And so what really interests me is helping people make the most out of those precious little minutes that we get, and kind of understanding that there's only so much that the physician on that end can do. Is what I'm trying to do is really empower and educate patients, not only with like the basics of autoimmunity and rheumatology conditions and those things, but also giving them real questions for them to think about themselves when they're looking at kind of what's going on with them, and also bring with their doctor. Because I think people don't know, what I have found is a lot of people don't know even what to ask, like what they should be thinking about, what their doctor's thinking, and how they can meet in the middle. And so that's what I'm trying to do with the YouTube channel, and really kind of bring up things that they might not think about, especially when you don't feel well. Like when you don't feel well, it's really hard to kind of think about these things. And so, yeah, just
That's
what
very
you should be
true.
thinking about, what kind of questions to bring up with your doctor. I mean, as not a patient, but like a family member of a patient, I've sat in as an observer or as like a supporter of someone having a very important medical visit, very smart woman, you know, lawyer, like runs a courtroom, and in the clinic just turned to mush, like didn't ask any questions, didn't like do anything, and then left the visit and complained about the visit and how she didn't get the answer she needed, and this doctor didn't listen to her. And it just really, seeing it from that end, because I see it from the other end as the doctor all the time. But I really think if we've only got 5 to 10 minutes, we got to make the most out of those 5 to 10 minutes. And so helping people understand what they should be thinking about and asking. So just, yeah, same problems with just trying to attack it from different angles.
I would like to thank you very much for this very enlightening conversation. We should meet again and talk more about the way that we can help patients, because we can really contribute to their life and lifestyle, and their understanding from multiple angles. And once again, thank you very much for taking the time to be with me today.
Oh, well, thank you for having me. This has been fun.